طيب بنكمل الآن على بعض السيمتومز من البناين بروستاتيك هايبربليشيا. بشكل عام اخترت هذه الصور حتى تفرجينا what are the most common complaints or signs and symptoms from benign prostatic hyperplasia. Suppose that a patient comes to your pharmacy and you start a discussion with them. You should be aware of what kind of symptoms do you expect from that man. First of all, displeasure from residual urine. So it's very annoying to have residual urine. The weak urine stream, it's kind of very weak, and they have urgent urine. Sometimes they cannot wait. For example, this is driver stopped on the shoulder of the street, then he will do it. Number 4, frequent urine at night. They might wake up during the night and go to the bathroom. Much force needed because there is obstruction around the urethra. So the prostatic gland is pushing against the urethra, so urinary outflow is obstructed. There is you need more pressure to force that urine to get out. And number 6, losing libido also is one of the symptoms of that disease. Now, we divide the symptoms of benign prostatic hyperplasia into 2 categories. The first one is the obstructive, the second one irritative. So the obstructive related to the obstruction of the urethra, what we call it prostatism, which means obstruction of the bladder outlet to empty the contents of the bladder. So we will have poor flow of urine, hesitancy and initiation of micturition. So hesitancy يعني انه في احيانا تبول، احيانا ما بيشعر المريض، ففي هذا الهيزيتنسي يعني راح يكون موجود. Post micturition dribble, sensation of incomplete emptying, and occasional acute retention of urine. The other category is irritative. We'll have failure of urine storage, so the urine cannot store much. Then they have the frequency, of course. They'll have nocturia, urgency, and urge incontinence. So these are kind of irritative symptoms, making the patient very irritated and displeasure, of course, from these symptoms. How can we diagnose benign prostatic hyperplasia? We have to get carefully the medical history of the patient, the thorough medication history. It could be a drug-induced symptom. Physical examination, normally you need a urologist to do that, or a physician to do the what's so-called digital rectal examination, or DRE. They can touch the prostatic gland directly and trying to see the size, to feel the size of the prostate, if it's enlarged, making any kind of obstruction or not. And by experience, they can determine, of course, the normal size of that prostatic gland. Do we have laboratory tests for that? We could do BUN, blood urea nitrogen, and serum creatinine to check for renal impairment. They are not diagnostic for BPH, but they help to exclude if there is any renal impairment. Another test normally in the prostate science that we normally do is the PSA, prostate specific antigen. This is normally elevated if there is a carcinogenic growth or a cancerous growth, not benign. So this way the physician can distinguish whether this enlargement, is it a benign or a malignant tumor. The most powerful and useful diagnostic criteria is the American Urological Association symptom score, or the AUA symptom score. In this scoring system, we will have a table with certain questions. So basically, we ask the patient and check the complaints. We'll give each one based on the occurrence of each symptom. For example, how many times do you go to the bathroom? How many times do you have dribbling? How many times do you have obstruction? How long between each time you go to the bathroom? Then you You will give it 0, not at all. The symptom is not available there. It's not present in that patient. 1 less than 1 times, for example, and the highest score always, or almost always 5 times. Then you will give each row, you will give it a score. At the end, you add the summation or the total symptom score. Then you will have a symptom score. So the best method for diagnosis, normally, collectively, the more detailed you are. So I think most of these methods, they should do all of these, but mainly the AUA symptom score is the most reliable one that physicians normally rely to diagnose the benign prostatic hyperaplasia symptoms. Beside the medical history, of course, you collect what the signs and symptoms the patient have. So then you will end up with a total symptom score between 1 and 35. So when should one do that test? If they have symptoms, of course. If they have similar symptoms, again, the physician would order that, and urologist is familiar with that. So again, most men after 40, they should have a routine check of their prostate, like every year, for example. So mainly after the age of 40, or if they have earlier symptoms, earlier than 40 years of age, they have similar symptoms. So our role as pharmacists to educate people, if they have similar symptoms, recommend them go and see your urologist so they can make these diagnostic criteria. So again, the total symptom score, if it's between 1 and 7, this is a mild BPH. If it's 8 to 19, it's a moderate BPH. And if it's more than 20 to 35, let's say, it's a severe BPH. So this is, again, the categories of BPH disease severity based on symptoms and signs. Here, again, if you have less than 7, the AUA total score is less than 7, we will have maybe asymptomatic. The peak urine flow rate is less than 10 milliliter per second. And the post-void residual, we call it, which is the volume of the urine that stays in the bladder after voiding. We call it post-void residual. So normally it should be almost 0 because you empty the whole bladder. But in those patients, there should be kind of, they're having, some PVR or post-void residual volume. It's normally more than 25 to 50 milliliters staying in the bladder. And that can be measured by physicians, of course, who are urologists and familiar with these diagnoses. If the score also between 8 and 19, as we said, we classified as moderate. So we have all of the above signs plus obstructive voiding symptoms and irritative voiding symptoms, signs of detrusor instability. Detrusor is the muscle that controls urinary bladder. So the bladder itself has this detrusor muscle. When this muscle contracts, then there is, there is residual volume will increase. There is no leak of urine. So we need that detrusor muscle to be relaxed in order to get the urine out. But in this case, we'll have it sometimes get contracted, then we'll have more urine retention. Severe, if that's more than 20, the total score, all of the above symptoms and signs, plus 1 or more complications of benign prostatic hyperaplasia. اوكي سو خلينا ناخذ كم سؤال وبعدين بنرجع بنكمل هذا الجزء. جاهزين؟ حكينا من شوي عن norepinephrine causes relaxation of the prostate capsule, right or wrong? طيب يلا معلش الجميع يشارك معنا، لسه في 30 واحد يعني نص الحضور تقريبا. ولسه في ناس سرحانين معنا مش مجاوبين. يا شباب في عندنا سؤال، خلينا متابعين مع بعض. Norepinephrine causes relaxation of the prostate capsule. Good. No. Yes or no. والإجابة الصحيحة هي no طبعا، لأنه هي بتعمل إيش؟ contraction، حكينا من شوي، مش هيك؟ طيب السؤال اللي بعده بيحكي لي BPH is the most common benign tumor in men. يلا على السريع نشوف الجميع صحصح معنا ويعطينا الإجابة بسريعة. فقط simple click، في أسهل من هيك؟ Very good. يلا 10، لسه 10 ضايلين سرحانين معنا ال10، أو إنهم الإنترنت سلو، خلينا نعطيهم good reason. والإجابة الصحيحة طبعا هي yes، طبعا هو كانت ال BPH is the most common benign tumor in men. next question هو بيحكي لك عن the prostate. Testosterone is converted into dihydrotestosterone by the enzyme phosphodiesterase. والإجابة الصحيحة طبعا هي خطأ، لأنه هو بالفايف ألفا ريدكتيز. مظبوط، حكينا الفوسفودايستريز كنا بنحكي عنه بالإركتايل ديسفانكشن، بينما هون عندنا الفايف ألفا ريدكتيز انزيم هو ومنه الايسوفورم 1 وايسوفورم 2. ونكست كويشن راح يكون على ال DHT dihydrotestosterone causes enlargement and hyperplasia of the prostate. Very good. والإجابة الصحيحة هي yes طبعا، إنه حكينا it's a potent، يعني more potent than testosterone itself، و it causes hyperplasia of the prostate gland. next question هو عن إيش؟ Testosterone alpha agonists and cholinergic drugs may cause BPH symptoms. والإجابة الصحيحة طبعا الأغلبية جاوبوا صح أكيد، فثانك يو، هي نو، لأنه التستوستيرون صح، الكورينيرجيك الأنتي كورينيرجيك دراجز والألفا أجونست، الألفا أجونست صحيحة، بس هي الكورينيرجيك دراجز هي في الواقع الأنتي كورينيرجيك دراجز اللي بيزيدوا هذا الشيء. طيب اللاست كويشن في مجموعة اليوم هو عن benign prostatic hyperplasia، ونحكي عن ال American Urologic Association score of 9 is considered moderate BPH symptom score. شو تصنيف ال 9؟ Very good، يعني الأغلبية أو الكل جاوبوا صح، فالإجابة الصحيحة هي yes، فأكيد 9 هي moderate طبعا score. طيب what about the treatment of benign prostatic hyperplasia؟ فقط يعني بشكل مختصر وبنكملها next، يعني next time. The objective of treatment is to control symptoms. Again that symptom كيف نحدد انه هل عملنا control للsymptoms او لا، as evidenced طبعا by a minimum of a 3-point decrease in the AUA symptom index. Again حكينا من 1 ل above 20 او 35، فإذا نزلنا السكور by 3, that's an evidence of controlling the symptoms. The treatment is normally to prevent the progression of complications of BPH disease. So we don't cure that disease. We are just trying to slow down or prevent the progression. And we also tend to delay the need for surgical intervention. So ultimately, if the prostate is too big, we need to surgically remove the prostatic gland. And again, we will follow the AUA guidelines on management of benign prostatic hyperplasia. نكتفي لغاية هذا القدر وبنكمل إن شاء الله